Going to body identical hormones, that's completely different to the birth control pill, because when you start talking about body identical HRT, that's hormone replacement therapy, and hormone replacement therapy is not a contraceptive because it's a very low dose compared to birth control pills. And it's generally nowadays more natural hormones are used, and the bioidentical or body identical just means they are made in a lab, but they're made to be the same as our own body would produce estrogen and progesterone.
Okay.
Whereas some of the other old-fashioned HRT preparations are not natural estrogen or natural progesterone.
Okay.
And the reason for that was because in the early days, I mean, they used to use estrogens that were made from pregnant horses' urine.
Oh.
Yeah. And so conjugated equine estrogens, we called them, and very synthetic progestogens. Yeah. And we know that they have the higher risks, and that's possibly why the higher risks were identified all those years ago in
yes.
the research studies, that the Women's Health Initiative study, for example, that was like, you know, in the late 90s and early 2000s. So we tend to not use those anymore, at least specialists who know about menopause don't, and we tend to use the more bioidentical preparations. But in the UK and throughout, you know, the North America and Australasian menopause societies in Europe, we say you must stick ideally with licensed preparations, because a clinic might pop up and say that they're making body identical or bioidentical hormones, but if they're not regulated and licensed, you don't know what you're getting. You could be getting a very fake form. You might be getting a massive amount of estrogen and not enough progesterone, and that can all, or the other way around, and that can all cause problems. So if you're going to have a body identical or bioidentical HRT, it may give you less side effects, but stick with licensed preparations from reputable clinics.